Welcome to the deep dive. Today, we're taking a deep breath and plunging into one of the most fundamental yet least understood parts of our health, sleep disorders.
It's a huge topic.
It is. We've gathered sources from clinical guidelines, neurology journals, behavioral therapy protocols, the whole stack. Our mission is to synthesize all of this, to give you a complete picture of conditions that affect nearly half the population.
Right.
From something as common as insomnia to, really specialized diagnoses like narcolepsy.
And that's exactly the goal.
Okay.
Because we're not just talking about feeling a bit groggy. These sleep problems are a genuine public health issue.
The numbers are staggering.
They are. Up to 40% of adults report insomnia symptoms. And crucially, these conditions, they don't exist in a vacuum. They sit right at this complex intersection of mental health, heart disease, respiratory medicine, and neurology.
So by the end of this, the idea is you'll be able to sort of clarify the terminology and spot the key signs of a serious condition.
That's the plan.
Okay, let's unpack this with the basics. Before we get into what goes wrong, we need to understand what healthy sleep even looks like. I think most people assume sleep is just one state, like being out cold.
Right, a simple on-off switch.
But it's so much more active than that. So fundamentally, why do we sleep?
It's the ultimate biological reset. It is absolutely vital for both physical and mental health. During sleep, your body is doing rest and repair, but your brain is also incredibly busy.
Doing what exactly?
Consolidating memories, clearing out metabolic waste, regulating emotions. If you compromise sleep, you compromise your ability to learn, to concentrate, and to manage your mood.
Okay, so it's not just passive downtime. Let's get into the science of it, this night shift the brain is pulling.
So when you drift off, you're not just in one state. You're cycling through two profoundly different types of sleep, non-REM and REM sleep. Let's start with non-REM, which really dominates the first part of the night.
And non-REM is what we'd typically call deep sleep?
Partially. It's actually broken down into 3 stages. Stage 1 is that very light transitional sleep where you might not even realize you were asleep.
The head nodding stage.
Exactly. Then you move into stage 2, and this is where you spend about half your total sleep time. Your heart rate slows, body temp drops, and the brain starts doing some really interesting things to keep you asleep.
So stage 2 is the real workhorse of the night. What about stage 3?
Stage 3 is delta sleep, or slow wave sleep. This is the deepest, most restorative kind. It's the powerhouse phase.
Powerhouse for what?
Physically, your body secretes growth hormones, so that's where most physical repair happens. And mentally, the brain is basically flushing out toxins that build up during the day. This stage is absolutely crucial for memory and mental function.
That's a helpful distinction. And then REM sleep is a completely different animal.
A completely different animal. It's the brain's playground. During REM, your brain activity actually looks a lot like it does when you're awake. It's highly active.
But your body isn't.
Right. Your muscles are temporarily paralyzed.
Yeah.
It's a state called atonia. This is when vivid dreaming happens, and we see those rapid side-to-side eye movements that give it its name.
So if the brain's so active, why paralyze the body? What's the point of these intense dreams?
Well, one of the main theories is that dreams let us safely practice dealing with, intense or negative emotions without actually having to act them out. It's a vital part of emotional regulation.
And this all happens in a cycle. It's not a straight line.
It's totally cyclical. For adults, a full sleep cycle, going through all the stages and then into REM lasts about 90 minutes. You repeat that 5 or 6 times a night.
But the cycles change.
They shift radically. The early cycles are really heavy on that deep stage 3 sleep. That's why waking someone up in the first few hours feels so awful. Later on, you get way more light sleep and much longer periods of REM.
Which gives us our baseline. 7 to 9 hours is the average. But how do you know if you're actually getting enough?
Forget the clock for a second. The real test is how you function during the day. If you feel alert, rested, productive, then you're probably getting enough sleep for you.
And waking up is okay.
Waking up is totally normal. It's completely fine to wake up briefly a few times a night, as long as you can fall back asleep pretty quickly.
Okay, so if that's the healthy architecture, let's talk about when that architecture fails. Insomnia. It's the one everyone knows, but the clinical definition is actually quite specific, isn't it?
It is. Insomnia isn't just not sleeping well. It's difficulty falling asleep, or staying asleep, or waking up too early. Plus, a really crucial second part, daytime impairment.
Why is that daytime part so critical for a diagnosis?
Because if you wake up after 6 hours and you feel great, you're functioning well, you just have a shorter sleep need. But if that 6 hours leaves you irritable, unable to concentrate, feeling unwell, That's when it's a disorder.
And then you classify it as either short-term or chronic.
Right. Less than 3 months, usually stress-triggered, is short-term. Chronic is 3 or more nights a week for 3 or more months.
Now, a lot of people might reach for something like a glass of wine thinking it'll help them drift off. What do the sources say about that?
That is a massive misconception. Alcohol might help you fall asleep faster. Sure, it's a sedative. But it absolutely destroys your sleep architecture later in the night. It suppresses REM sleep and causes you to wake up as it metabolizes.
And caffeine.
Well, obviously it's a stimulant, but people forget about its half-life. It can be 4 to 6 hours. That coffee you had at 4 p.m. is still messing with your brain chemistry at 10 p.m.
So someone has chronic insomnia, they've tried all the basic sleep hygiene stuff. What's the treatment that actually works? Because I think the default is to ask for a sleeping pill.
This is where we need a complete paradigm shift. For chronic insomnia, sleep hygiene is important, but it is not a treatment. The gold standard internationally is cognitive behavioral therapy for insomnia, CBTI.
And the success rate is huge.
It's about 80% effective in chronic cases. It's incredible.
80% without medication, so what makes it so powerful?
It gets to the root cause. Insomnia creates this massive performance anxiety. People start to associate their bed with frustration, with being mentally on. CBTI uses techniques to break that negative cycle and reduce the hyperarousal.
Which explains that amazing phrase the sources use. Tired but wired.
That phrase is perfect. It captures it exactly. You are physically exhausted, but your brain's stress response is still firing on all cylinders. You're tired, but your mind just will not shut down.
And that's what makes it so different from other disorders where people are just overwhelmingly sleepy.
Exactly. It's the opposite of something like narcolepsy or sleep apnoea, where the main symptom is an uncontrollable urge to fall asleep during the day.
Okay, let's move on to that. If insomnia is the mind being too active, obstructive sleep apnea, or OSA, is a physical problem, and it is shockingly common.
Frighteningly common. We're talking 1.5 million people in the UK, and up to 85% of them are undiagnosed.
85%? That's a huge public health issue.
It is. The mechanism is purely physical. During sleep, the muscles in your upper airway relax too much, and the airway actually collapses. That leads to an apnoea, a total stop in breathing, or a hypopnea, which is a big reduction.
And what happens in the body when that collapse occurs?
Your oxygen levels plummet. The brain registers a suffocation event and forces a brief arousal, a gasp or a snort, to reopen the airway.
But you don't remember this happening.
Almost never. This can happen hundreds of times a night, and the person has no memory of it. So they're never getting into that deep restorative sleep. They're just stuck in this fragmented, light sleep all night long.
So what are the signs a partner might notice?
Loud, disruptive, habitual snoring is number one.
Mm-hmm.
And then witness apnoeas, where a partner actually sees them stop breathing, followed by a choke or a gasp. The person themselves will feel it the next day. Morning headaches, poor concentration, and crucially, excessive daytime sleepiness.
And connecting this to the bigger picture, this puts a huge strain on the body.
An immense strain on the cardiovascular system. Untreated OSA is a major risk factor for high blood pressure, type 2 diabetes, atrial fibrillation, stroke, heart failure. It's a really dangerous cycle.
So management is less behavioral and more mechanical. What's the standard treatment?
Lifestyle changes like weight loss are key. For mild cases, a special mouth guard, an oral appliance can help. But for moderate to severe OSA, the first-line treatment is the CPAP machine, continuous positive airway pressure.
How does that work?
It's basically a small, quiet air pump. You wear a mask, and it delivers continuous, gentle air pressure that acts like a splint to physically keep your airway open all night. It prevents the collapses from happening.
And this brings us back to public safety. The driving rules here are really strict, aren't they?
They are non-negotiable. If you have confirmed moderate or severe OSA with excessive daytime sleepiness, you must legally stop driving immediately and tell the DVLA. You cannot drive again until your symptoms are confirmed to be fully under control with treatment.
Okay, let's move on to some of the less common but equally important conditions. Restless leg syndrome, RLS.
RLS. It affects up to 10% of people, but it often gets dismissed as just, fidgeting.
That it's much more than that.
Oh, it's far more specific and distressing. It's this overwhelming, uncomfortable urge to move your legs. People describe it as a creepy, crawly, or burning feeling. It's worse at rest, at night, and it's only relieved by getting up and moving.
And what's fascinating here is the link to something really simple that can be checked with a blood test.
This is the diagnostic pearl. RLS can be primary, but it is very often secondary to something else. We always have to check for iron deficiency, specifically looking at a protein called ferritin.
Why iron?
Iron is critical for how your brain uses dopamine, and when those levels are low, it can trigger RLS. It's also strongly linked to kidney disease and pregnancy.
So the first step is often just treating that deficiency.
Exactly. Treat the underlying cause and counsel people to avoid things that make it worse, like certain sedating antihistamines.
Okay, now for narcolepsy. This is rare, but it's often misunderstood. We need to be really clear about the red flags here.
Narcolepsy is a disorder where the brain can't maintain a clear boundary between being awake and being asleep. The number one red flag is severe excessive daytime sleepiness. People have these sudden, overwhelming sleep attacks.
But the real defining symptom, the one that is the dead giveaway, is cataplexy.
Yes. Cataplexy is a sudden, brief loss of muscle weakness while you are fully conscious. It can be a slight drooping in the face or a total body collapse. And crucially, it's almost always triggered by strong emotions.
Things like laughter or surprise.
Exactly. Laughter, excitement, anger. The underlying problem in most cases is a loss of brain cells that produce a chemical called hypocretin, which stabilizes wakefulness.
So without it, the brain just sort of trips into sleep.
It essentially jumps from being awake straight into the muscle paralysis of REM sleep. That's what cataplexy is, the REM paralysis mechanism kicking in at the wrong time.
So with cataplexy, a specialist referral is absolutely mandatory.
Immediately. Management needs a specialist team with medications like modafinil and a real focus on scheduled naps to manage the sleepiness.
And just quickly, what about things like sleep terrors and sleepwalking?
Those are parasomnias, unwanted behaviors during sleep. They happen when you get a partial arousal out of that deep, non-REM sleep. With sleep terrors, you see screaming, crying, but the person has no memory of it. The key thing with these is safety.
Right.
Gently guide the person back to bed, make sure windows are locked, just basic environmental safety.
Okay, we've covered a lot of ground. Let's make this practical. For someone listening who struggles with chronic insomnia, what are the most powerful techniques from CBTI that they can start using?
Okay, let's focus on two. The first is called stimulus control, and it's all about aggressively protecting the sleep space. Meaning you need to create a rock-solid positive association between your bed and sleep. So the bed is only for sleep, getting dressed, and intimacy. That's it. No reading, no worrying, no phones, no work in bed.
And the key rule that follows from that.
If you're in bed and you can't fall asleep after about 20 minutes, you have to get up. Leave the room. Go do something relaxing and low-key, and only go back to bed when you feel sleepy again. The goal is to stop training your brain that the bed is a place for anxiety.
That ties into another really powerful tip from the sources, which is that people with insomnia often go to bed too early.
They absolutely do. They're so tired they think going to bed at 9 p.m. will help, but it just gives them more hours to lie there frustrated. A core part of CBTI is actually delaying your bedtime until you're genuinely sleepy.
So you temporarily shorten the time in bed to improve the quality of the sleep you do get.
Exactly. You improve your sleep efficiency first. Once you're falling asleep quickly every night, then you can slowly start moving your bedtime earlier again, maybe 15 minutes at a time, building back the quantity without losing the quality.
What about preparing the mind, the wind-down period?
It's critical. You need 30 minutes to 2 hours before bed for active de-stressing. A warm bath or shower is great because the drop in body temperature when you get out actually helps trigger sleep. Another powerful one is writing things down.
A brain dump.
Yeah, a brain dump. Get all your worries, your to-do lists out of your head and onto a piece of paper. Mentally park them for the night.
And if someone's doing all that, but they still feel physically tense in bed?
Then they should try progressive muscle relaxation, or PMR. It's a simple technique. You systematically tense a muscle group like squeezing your fists really tight for 5 seconds, and then you completely release it for 20 seconds. And you focus on that feeling of relaxation rushing in. It's a powerful way to reduce that physical hyperarousal.
So what does this all mean? We've covered the science of deep and REM sleep, the 4 major sleep conditions, and some really actionable behavioral steps. The big takeaway for me is that there's a lot of hope here. These things are highly treatable.
They are, often through things like CBTI or targeted treatments like CPAP, or even just a simple iron test. And if we connect this to the bigger picture, given the incredibly strong links between poor sleep and serious health risks, obesity, hypertension, heart attacks, stroke, we have to stop treating sleep like a luxury. It is a fundamental public health priority.
Especially with modern life.
Especially now. With the challenges of screen time, always-on work culture, and especially the stress on shift workers' body clocks, our environment is actively fighting our ability to rest. Managing your circadian rhythm isn't just nice to do, it's critical for safety and long-term health.
So the final thought for you listening. If poor sleep is consistently affecting your daily life, your mood, or if you notice any of those red flag symptoms we talked about, gasping at night, muscle weakness with emotion, it is time to seek professional advice. Understanding these disorders is the first most powerful step toward reclaiming your rest.